My name is Jason Lauve. I'm a cannabis patient in Colorado, and I was acquitted of having my 2 pounds 2 ounces of medical cannabis last year. And as a patient, I found that it was very difficult to find the information relating to the scientific evidence and research and education relating to how cannabis can help me. And so as a result of my case, a whole bunch of things have happened in Colorado. Specifically in my personal space, my personal profession, I have totally shifted careers. I've started to publish Cannabis Health News magazine, which is a magazine for patients, produced by patients. And our main intent is to educate and inform the public about how cannabis can help us with health-related issues, whether it's pain, glaucoma, diabetes, obesity, and the list goes on from there. Been able to learn to deal with my pain and my own muscle spasms and discomfort, side effects from other medication with cannabis, but I've also been able to get off of all of my pharmaceuticals at this point, so I don't take any pain medication whatsoever. And in that process, I've learned that I'm healing, I'm getting better. I put on about 20 more pounds. I feel like I have my cognitive ability is back. I can think, I can relate to people again in a very positive way. My anxiety, my pain levels have all dissipated, if you will, with the use of cannabis. From my acquittal in Boulder County, I started publishing the magazine and have had wonderful success in reaching out to a lot of the other patients out there that normally wouldn't have thought about using cannabis as a medicine. And that's really who I think is the most important population right now, is to reach out to people, to really give them the information so that they can make their own decisions about their health. And whether that's using cannabis or not, it's really a step in the right direction. It's a dialogue that we all need to have. One of the most important issues that I see confronting patients today is that new patient who learns from someone like myself or another patient that cannabis may help them for their ailments. In my case, for chronic pain and muscle spasms and other related ailments from side effects from my medications, but other people may benefit for reducing their blood sugar levels, for example, in diabetes. So one of the concerns I have is that a new patient may walk into their physician and say, "Hey, I just talked to Jason, and he says, you know, cannabis helped him, and I have a similar ailment. Can it help me?" The problems are that the physician themselves might not have the education or the research knowledge related to cannabis to be able to inform the patient about the correct information. And so I've had patients tell me, for example, that doctors will respond with, "Hey, it'll put holes in your brain," for example, which I think is kind of sad, because obviously that's not going to happen. It's not a direct causal relationship where we actually get holes punched in our brain. I mean, it sounds like a cartoon in a way. And so my fear there is that it could either turn off that patient, the patient could end up going to another physician, or they might not get the help that they need. On the other side of it, if the doctor is open about the conversation, they may not be able to refer that patient to a dispensary or an appropriate knowledgeable person to be able to inform them about how cannabis will help. Physicians nowadays are very overwhelmed by not only their patients and insurance and all that, but also pharmaceutical companies coming in and trying to market their medications as well. And so a physician doesn't really have the time to go off and research cannabis, for example. And so what I found is that the patient really needs to be informed ahead of time and be able to go into the physician's office prepared with the right questions and with the right information to share with their doctor. Essentially, it would kind of look like this. I would go into my doctor and say, "Hey, I just found this information on the internet, on PubMed, on Cannabis Health News, or whatever the resource might be. Can you please take a look at it?" And at that point, the physician hopefully will be open enough to at least acknowledge the information and read through it. And I think that that's an important beginning to a conversation. From there, it's very difficult then for the patient to figure out, well, where do they go to find their medicine? There's lots of dispensaries in Colorado. Not all dispensaries, or centers as they're called now, are the same. They all have their own understanding of what medical cannabis is. Honestly, some of them are pot shops. I don't think that they necessarily understand what a cannabinoid is, for example, and how endocannabinoids relate to our physiological system. And so if a patient goes into a place like that, they hit another dead end or another end of the road situation, and they either get turned away, they get the wrong information, excuse me, turn that off, and sometimes they will be fearful at that point. And another thing I see happening is that patients may get the right information. They might go into a dispensary and ask for medication. Let's just say it's in an edible, so maybe they eat a brownie or something like that. And unfortunately, if they're a new patient, they may eat too much. And that can result in a very negative or adverse effect because the individual is not used to how it feels in the body. And so a lot of times, the most important thing I'll tell a patient is if someone tells you to eat one portion of this, or whatever it might be, I say take a tenth of that. Let it sit in your body for about a half an hour, and then try a little bit more if you feel like it's necessary, but definitely avoid overdosing on this. And it's not like overdosing is going to hurt you, but it might make you feel uncomfortable. And so to me, that's a really important aspect of cannabis to understand, is it's something that affects all of us very differently. It has a wide range of dosages in terms of something might affect me very differently than it's going to affect you. And it has really very little to do with what we would perceive as logical ways to evaluate that: body weight, metabolism, all those kinds of things. So again, it's really important to find an individual, a caregiver or a dispensary owner who's knowledgeable in these things. So last year, when I was acquitted of having my 2 pounds 2 ounces of medicinal cannabis in Boulder County, my case set precedent for two things. One of them being that as a patient, we're the ones who determine how much is medically necessary. So in other words, ultimately, I'm the one who makes the decision about my health, not my physician, not my caregiver, not anybody else. Ultimately, it's my responsibility to put what I feel is right into my body to improve myself. And the other was that I was charged with concentrate possession, which is essentially hash or hash oil. I had keef, which is the powdered form or the crystals that have been knocked off the plant, and I was ingesting that or eating that at the time. And so that was another charge that I was acquitted of, and basically it set an example for the state that we can use extracts and other forms of ingesting or using cannabis, whether it's sublingually or other methods. I became a medical patient, medical cannabis patient about 6 years ago, about a year and a half after I had my accident up at Eldora. And at the time, I only knew what I knew. I didn't have the access to the information that we have today, and so it was a learning process. I had to experiment basically with what would work for me, how cannabis would work in terms of pain relief and muscle spasm relief. Over the last 2 years, since my raid and my acquittal, I've learned a tremendous amount of information regarding the scientific references and research related to medical cannabis. And what I know now is profoundly different than what I thought I knew then. And at this point, I do not recommend cannabis to everybody. I think, yes, it's a valuable medicine. It can help many, many people, but it's still something that we have to be careful of. So for example, a schizophrenic that gets exposed to a high level of THC might have an exacerbated response and outburst, for example. So it takes a predisposed issue and can magnify it. But that's not to say that that same person, that same individual with that ailment can use a high CBD or cannabidiol ratio and lower THC or lower tetrahydrocannabinol and benefit from that. It wouldn't create as high an anxiety level or problems that, say, THC would. And so I've learned that it's not just pot, as we've all been told. Cannabis is an array of I think it's over 108 cannabinoids at this point, and we've only discovered, I think, about 66 of them or so. So we're just beginning to really learn about how the different elements of this plant benefit different ailments. And so, for example, cannabidiol can help with anti-inflammatory effects. THC can help with pain mitigation, but certain types of pain mitigation. It doesn't necessarily help with all the types of pain that we all have, whether it's muscle pain, nerve pain, bone pain, like cancer pain, if you will. And so ultimately what I've learned, and what I would share with the rest of the patients out there, is that there's a whole slew of research that's been done, and we've only been exposed to such a small, minute amount of it that we really don't know how much where in other areas that this is really going to benefit us. We see the benefits right now, but I really look forward to learning more and more about how this can help in other areas.